Hello and good afternoon, dear students. Today we will discuss about hyperparathyroidism. So before discussion of hyperparathyroidism, we will discuss that what is the parathyroid hormone. Parathyroid hormone, which basically secreted from the parathyroid gland, and what is the main function of the parathyroid hormone. Main function of the parathyroid hormone is to increase the level of calcium in your blood and decrease the level of phosphate in your blood, okay, and increase the level of urinary CAMP. So if someone asks you a question that what is the function of the parathyroid hormone, what we will give the answer? We will say that the main function of the parathyroid hormone is to increase the level of calcium in your blood, decrease the level of the phosphate in your blood, and increase urinary CAMP. Okay, now we will discuss that how parathyroid hormone basically act. Parathyroid hormone act on three sides. Number one, I will discuss one by one. First side, it will act on GIT and cause the absorption of, it will act on GIT. On GIT, what it will do? It will act on GIT and basically it cause the absorption of calcium plus phosphate. When calcium and phosphate both will be reabsorbed, then where it will go? The both will go into your blood and it causes to increase the level of calcium and phosphate where in the GIT. Okay, other side, it basically also act on your bones and it causes the resorption of bone. Resorption means breakdown of the bone. What you do? The resorption of a bone. So when it will work on bone, it causes the resorption of bone, and when the bone will be resorbed, then it means that calcium and phosphate both will be removed from the bone, and the calcium and phosphate both will enter from the bone into your blood. Calcium and phosphate will remove from your bones, and where it will go? It will go into your blood. When calcium and phosphate both will go into your blood, then what we will see? We will see high level of the calcium and high level of phosphate. So this one is the most important mechanism. The third one, what the parathyroid hormone do? When the blood will go toward the kidney, at that time parathyroid hormone basically act on the proximal convoluted tubules. When parathyroid hormone will act on the proximal convoluted tubule and it inhibit the reabsorption of paraphosphate. Okay, when reabsorption of phosphate will be inhibited, when where the phosphate will go? Phosphate will go into urine. We will say the phosphate will go into urine. So when phosphate will go into the urine, what will be the final result? The final result will be the low level of phosphate in your blood. Okay guys, and it basically act into the kidney on distal convoluted tubule. When it will act on the distal convoluted tubule, then what it will do? On distal convoluted tubule, it basically reabsorb. What it do? Reabsorb of calcium. Okay, when calcium will be reabsorbed, it's mean that calcium, where it will go? The calcium will go into blood. When calcium will go into blood, then the calcium level will be high. So I already have mentioned that what is the main function of parathyroid hormone? Main function of parathyroid hormone is to increase the level of calcium and decrease the level of phosphate in your blood. Okay guys, and other than that, we have to understand one thing which is very important guys, that what is the other function of parathyroid hormone related to the calcium and phosphate. Parathyroid hormone act on kidney. Parathyroid hormone act on kidney. When parathyroid hormone will act on the kidney, then what it will do? Parathyroid hormone, when it will act on the kidney, it basically with the help of 1-alpha hydroxylase enzyme, it activates the 1-alpha hydroxylase enzyme, and when 1-alpha hydroxylase enzyme will be activated, at that time active form of the vitamin D will be formed. Which will be the active form of the vitamin D will be formed. Active form of vitamin D. And what is the name of active form of vitamin D? We will say it is a vitamin D3 or calcitriol. Okay, calcitriol or 125 dihydroxycalciferol. These three are the name of active form of vitamin D. So I have already mentioned 2 to 3 things which are very important. What is the main function of the parathyroid hormone? We will say parathyroid hormone, which is a hormone to basically release from the parathyroid gland, number 1. After that, we will say the main function is to increase the level of the calcium and decrease the level of the phosphate and also increase urinary CAMP. Okay guys, other than that, we will say that How it increase the level of the calcium and decrease the level of the phosphate? We will say it will act on the GIT and cause the absorption of both calcium and phosphate. It will act on the bone and cause the breakdown or the resorption of the bone, and will remove the calcium and phosphate from the bone, and where the calcium and phosphate will go, it will go into your blood, and the level of the calcium and phosphate will go increase. On the third side, this is important, on the third side, the parathyroid hormone will act on the proximal convoluted tubule, and it cause the inhibition of the reabsorption of the phosphate, and the phosphate will go into the urine. When phosphate will go into the urine, so low number of the phosphate will go into the blood, so the phosphate level will be remain low in blood. Other than that, parathyroid hormone act on the distal convoluted tubules, and it cause the reabsorption of the calcium from the distal convoluted tubule. When reabsorption of the calcium will be occurred, so it means that the calcium is going into your blood. And what is the final result? The final result is that parathyroid hormone increase the level of the calcium, decrease the level of the phosphate in your blood. Other than that, we will say that parathyroid hormone also cause the activation of the vitamin D. How it cause the activation of the vitamin D? We will say that the vitamin D will go into the kidney, and parathyroid hormone will go and stimulate the 1-alpha hydroxylase enzyme. When alpha hydroxylase enzyme will be stimulated, then at that time the storage form, storage form of vitamin D will change into the active form. The storage form will change into the active form, and vitamin D will be active. Just take an example that if the parathyroid hormone will not produce, when parathyroid hormone will not produce, then 1-alpha hydroxylase enzyme will not be activated. Then when 1-alpha hydroxylase enzyme will not be activated, it means that the storage form will not change into the active form. When active form will not be produced, then it means that in our body there will be the deficiency of vitamin D. And what will be the result of the low level of vitamin D? We will see there is a low level of the calcium and the phosphate will see in the body. Other than that, guys, what is the name of the other name of the vitamin, active form of the vitamin D? Will say vitamin D3, calcitriol, and 125 dihydroxycalciferol. Now we will discuss the pathology of hyperparathyroidism and medicine of hyperparathyroidism. I hope so till here everyone who is listening me understand in a very good way. Okay, first of all, we have to understand that about hyperparathyroidism, that how many types of hyperparathyroidism. Guys, there are three main types of hyperparathyroidism. First of all, if there is a problem into the gland, mean that if there is a problem into the parathyroid gland, and if due to the problem into the parathyroid gland the secretion is high, we will say that this condition is known as a hyperparathyroidism, and this condition is known as a primary hyperparathyroidism, where if problem in gland, in gland, okay, number one. And we will say that if the most common cause of primary hyperparathyroidism, if problem in the gland, we will say it is a primary hyperparathyroidism. And in primary hyperparathyroidism, we will say the most common cause of primary hyperparathyroidism. Now we are going to discuss in full detail primary hyperparathyroidism. What is the most common cause of primary hyperparathyroidism? The most common cause of primary hyperparathyroidism is a parathyroid adenoma. What is a parathyroid adenoma? I mean, there is a tumor, and it is a 80% cause of hyperparathyroidism. Other than that, we will say parathyroid hyperplasia, and the least one is a parathyroid carcinoma. Okay, guys, if a person have primary hyperparathyroidism, now I will ask you a question that in patient of primary hyperparathyroidism, what we will see? We will see high level of the parathyroid hormone, and when we will see the high level of the parathyroid hormone, then what is going to happen with the lab values? Then the level of the calcium is going to increase in your body, and the level of the phosphate is going to decrease in your body. When the level of the calcium will be the increase, then what we will see? High level of the calcium, what will do in our body? High level of the calcium, what will do in our body? So we have to understand all these things, that when the level of the calcium will be increased in our body, and this is very important question which is asked many time in the exam. Now I will write a question. The examiner asks a question like this, that a 40-year-old male, the examiner asks a question like this: a 40-year-old male present to you with complaint of bone pain, okay, flank pain, okay, epigastric pain which is radiating toward back, polydipsia, polyuria, constipation, polydipsia. Other than that, and psychotic problem, illness. Which of following iron is high in this patient? What you have to give the answer? This is a calcium. With the high level of the calcium, what we will see into the patient? We know that when the level of the calcium will be the high, at that time the calcium is a solute, so the chances of the kidney stone will be the high, and due to the chances of the kidney stone, what we will see? We'll see the flank pain, number one. Okay guys, and when we will see that due to the high level of the parathyroid hormone, this parathyroid hormone basically cause the reabsorption. You will say that this high level of the parathyroid hormone basically will remove the calcium and phosphate from the bone. When calcium and phosphate will be removed from your bone, it's mean that bone are demineralized now. When bone will be demineralized, at that time the chances of the bone pain and the bone fracture will be the highest. So that's why we are seeing the feature of the bone pain. Other than that, when there is a high level of the calcium, the high level of the calcium basically increase the level of the enzymatic activity. This is a basic point. Remember one thing in your mind in the entire your career of the medicine, that when the level of the calcium will be the high, the enzyme level will be high. When the enzyme level will be the high, we will see that the parathyroid hormone level will be the high. When parathyroid hormone will be the overactive, at that time it can lead to the pancreatitis, so the patient have the symptoms of the epigastric pain which is radiating toward back. Other than that, high level of the calcium basically can lead to the diabetes insipidus. I already discussed this thing in the previous lecture in the diabetes insipidus, in the nephrogenic diabetes insipidus in full detail, that hypercalcemia can lead to the diabetes insipidus. And which type of the diabetes insipidus? Nephrogenic diabetes insipidus. And in a patient of the diabetes insipidus, what do we see? In a patient of diabetes insipidus, we see the polydipsia and polyuria. So I have written here polydipsia and polyuria. Okay guys, and high level of the calcium, what it will do? It will cause the psychotic problem. And also high level of the calcium can cause low QT interval. This is also important. So guys, if any patient present to us with high level of the calcium, how we will treat this patient? Just take an example that if any patient who have the high level of the calcium, examiner also ask a question that how we will treat this patient. This is very important question. How we will treat? We will say that if any person present to us with high level of the calcium, we will treat first of all with IV fluid. With the IV fluid. So number one is this, that we will treat this patient with IV fluid, and after that what we will do? We will do the calcitonin, and we can also give bisphosphonate. So if someone asks you a question that a person present to you with a high level of the calcium and how you will treat this patient, you have to give the answer that first of all, first line treatment is the IV fluid. First of all, we will give the high amount of the IV fluids. After that, we will give the calcitonin, because calcitonin and parathyroid hormone both are opposite to each other. And other than that, we will give the bisphosphonate. So these are the three which are most important you have to remember regarding to your any type of the exam. Now what we will see into the lab values. Okay guys, let me tell something most important. As we know that when a person present to us with high level of the parathyroid hormone, mean primary hyperparathyroidism, when the patient will present to us with primary hyperparathyroidism, at that time the level of the parathyroid hormone will be high. At that time the level of the calcium will be high. At that time the level of the phosphate will be low. At that time the level of the urinary CAMP will be high. Okay, these are the lab findings which we will see in a patient of primary hyperparathyroidism. So these are the very important things which you guys have to remember, and these are the things which are very important, and never ever ignore these points. Okay guys, other than that, as I mentioned that the level of the calcium will be the high, the parathyroid hormone will be the high, and the level of the phosphate will be low. Okay, now we will discuss the secondary hyperparathyroidism. This was all about the primary hyperparathyroidism. Now we will discuss the secondary hyperparathyroidism. Other than that, we will also go into full detail of the treatment plan. Guys, in secondary hyperparathyroidism, how we will treat the patient of the secondary hyperparathyroidism? First of all, we have to understand that when parathyroid hormone will be released, as we know that parathyroid hormone basically cause and increase the level of calcium in our body, okay, and decrease the level of the phosphate in our body. Just take an example. If any person present to us with a low level of the calcium, this low level of the calcium will stimulate parathyroid hormone or no? Automatically it will stimulate. We know that when there will be the low level in our body, it will give the positive feedback to the parathyroid gland to produce the parathyroid hormone. So at that time parathyroid hormone will be high. When parathyroid hormone will be the high, so this condition is known as the hyperparathyroidism. But in which condition we will see the low level of the calcium and the high level of the parathyroid hormone? Let me discuss. Just take an example that if any person have the renal problem, okay guys, when any type of the person have the renal problem, at that time what we will see, we know that kidney was only site where on the proximal convoluted tubule phosphate was inhibited to reabsorb. It was inhibited to reabsorb, mean that phosphate reabsorption was inhibited and calcium was reabsorbed. Now I ask you a question. Just take an example that when your kidney are not working properly, at that time your calcium will be able to reabsorb from your distal convoluted tubule? No, it will not be able to reabsorb from your distal convoluted tubule. When calcium will not be able to reabsorb from your distal convoluted tubule, then where the calcium will go? This calcium will go into your urine. This calcium will go into urine. When calcium will go into the urine, what we will see? We will see the low level of the calcium in your blood. Number one, guys. Number two, we know that the main function of the parathyroid hormone is to inhibit the reabsorption of the phosphate from the proximal convoluted tubule. But now the kidney are not working properly, so parathyroid hormone will not work properly on the kidney. So what we will see in the secondary hyperparathyroidism, where the problem with the kidney, problem in kidney, we will say that when there is a problem in the kidney in normal person, then the kidney is working properly. At that time in normal person there is a high level of the calcium and the low level of the phosphate, okay, in blood in normal person. But when the kidney will not work properly, so you have to reverse this one. When we will reverse this one, we will see the low level of the calcium and a high level of the phosphate in our blood, okay guys. And other than that, we all know that the parathyroid hormone work is to active the vitamin D. And what is the main function of the vitamin D? Vitamin D main function is to increase the level of the calcium and also phosphate in your blood. Increase the level of the calcium and phosphate in your blood. Okay guys, let me tell you one thing. And as I have discussed that the main function of the parathyroid hormone is to increase the level of the calcium and phosphate in your blood. Just take an example that when vitamin D, the main function of the active vitamin D, is to increase the level of the calcium and phosphate in your blood. Now just take an example. When there is a problem with the kidney, then the vitamin D will be the active. No, vitamin D will not active. When vitamin D will not active, then what we will see? When vitamin D will not be active, at that time calcium plus phosphate will not go into your blood. Calcium and phosphate will not go into your blood. When calcium will not go into the blood, so the calcium level will also low. No, guys, tell me, when there will be the low level of the calcium, then the bone will be mineralized? No, bone will not be mineralized. So in a patient with the secondary hyperparathyroidism, what we will see? We will also see the bone pain. Now I will discuss that what we will see the lab values in a patient of the secondary hyperparathyroidism. Guys, in a patient of the secondary hyperparathyroidism, what will be the lab values? Number one, tell me guys, in patient of the secondary hyperparathyroidism, problem where? In kidney, okay, in kidney there is a problem. Number one, what we will see? We will see when there is a problem with the kidney, high level of the parathyroid hormone, low level of the calcium and high level of the phosphate, okay. If ever examiner ask you a question that a 35-year-old male present to you with a complaint of a high level of the just take an example, a 35-year-old male present to you with complaint of periauricular numbness, tingling sensation, and upon investigation there is a low level of the calcium, high level of the phosphate and correct level is a 2.3. What is your diagnosis? Now just see, periauricular numbness and tingling sensation is due to low level of the calcium, okay. When there is a low level of the calcium, we will see periauricular numbness and tingling sensation. Number two, we will say there is a high level of the creat and urea, there is a problem with the kidney, and also I have said that there is a high level of the phosphate. So if there is a problem with the kidney, calcium level is the low, phosphate level is the high, and parathyroid hormone level is the high. So this type of the hyperparathyroidism is known as the secondary hyperparathyroidism. Now what we are going to discuss? We are going to discuss about the tertiary hyperparathyroidism. That what is a tertiary hyperparathyroidism? Okay guys, when I am going to discuss about the tertiary hyperparathyroidism, we will say that this type of the patient who will come in a case of the tertiary hyperparathyroidism, this patient will be on case of the chronic kidney disease. Maybe the examiner will say that the patient is diagnosed with a chronic kidney disease from the last 6 to 7 years, and the patient is on the dialysis. The patient is on the dialysis. The chronic kidney disease patient is on the dialysis, and what we will see? We will see the high level of the parathyroid hormone. We will see the high level of the calcium and high level of the phosphate. And this condition is known as the autonomous production, uncontrolled production. Uncontrolled production. Mean that if any examiner, how the examiner will ask you a question? Examiner will ask a question like this, that a 65-year-old male present to you with complaint of high level of the parathyroid hormone, high level of the calcium. When there will be high level of the calcium, patient has the symptoms of which type? Mean that the examiner will see that a 65-year-old male present to you with complaint of polydipsia, polyuria, constipation, epigastric pain, and also the flank pain, which shows the kidney stones. And upon investigation, there is a high level of the parathyroid and hormone, high level of the calcium and high level of the phosphate. Upon investigation, the patient confirmed that the patient is on the dialysis from the last 6 years. From the last 6 years, what is your diagnosis? When the examiner will mention that this patient is on the dialysis from the last 5 or 6 years, you have to notice that this patient is of the tertiary hyperparathyroidism. Okay, guys. So in patient of the tertiary hyperparathyroidism, what will be the lab values? In a patient of the tertiary hyperparathyroidism, the lab values will be which type? Mean everything will be increased. Tertiary hyperparathyroidism, everything will be high. Calcium will be high, phosphate will be high, and parathyroid hormone will be also high. Everything is high. Okay, guys. Now we are going to discuss other thing. One is a pseudo hypoparathyroidism. What is mean by the pseudo hypoparathyroidism? Okay, pseudo hypoparathyroidism. What is mean by the pseudo hypoparathyroidism? Just guys, take an example that we know that this parathyroid hormone basically increase the level of calcium and decrease the level of phosphate in your body. Decrease the level of the phosphate, increase level of the calcium. Now just take an example that it act on the three sides. One is your GIT, other is your bones, and number 3 is your kidney. When parathyroid hormone will act on all these three sides, and we know that it will basically act on the receptors. Just take an example when receptor will be muted. Receptor will be muted, mean there is a mutation in the receptor. At that time, guys, tell me that when there is a problem with the receptor, then the parathyroid hormone will be able to work properly? No, because the receptor is not working properly. When there is a problem with the receptor, that time parathyroid hormone will not be able to work properly as in a normal person. So what you will see in a patient in which receptor is not working properly, then the parathyroid hormone will not work proper. When parathyroid hormone will not work proper, then what you will see the low level of the calcium and high level of the phosphate. Okay, guys, when just take an example, when any patient present to us with low level of the calcium, this patient is known as a tetany. Okay, not tetanus, tetany. No, due to the tetany, what we see? Periauricular numbness, tingling sensation, chevostic sign positive, Trozius sign positive. We will discuss later all these things. Okay, no, just take an example. If any patient present to you, just any patient present to you, okay, any patient present to you and patient say to you that doctor, I have a problem of periauricular numbness, tingling sensation, and you perform chevostic sign and Trozius sign. Upon performing the chevostic sign and Trozius sign, you see that there is a literally problem with the low level of the calcium in a person. You perform an investigation, and what you get the result? You get the low level of the calcium. No, upon you also have examined the things. The patient, you have examined the patient, and after examining the patient, you have noticed that there is a all these symptoms are occurring due to low level of the calcium. Okay, guys, and when there is a low level of the calcium, what we see? We know that the main function of the parathyroid hormone is to increase the level of calcium. Yes, is to increase the level of calcium. And if there is a low level of the calcium, it's mean that maybe the parathyroid hormone is not working properly. Yes, maybe the parathyroid hormone is not working properly. This is the main problem. Or maybe there is a problem with the kidney. So that's why you are seeing the low level of the calcium. I already discussed about the secondary hyperparathyroidism, that in secondary hyperparathyroidism you will see the low level of the calcium but high level of the parathyroid hormone due to the kidney problem. But if a person have no kidney problem, if the person have the only low calcium level, kidney is working properly, and what you will see? You will see the low level of the calcium basically indicating that parathyroid hormone is not producing in an enough amount. No, what you will do? You will check the parathyroid hormone. You will check the parathyroid hormone, but in result you will see parathyroid hormone is high. Parathyroid hormone is high. No, what you will see? You will see that in this patient the symptoms are of low calcium, but in labs high level of the parathyroid hormone. So this person who have the low level of the calcium and high level of the parathyroid hormone, this condition is known as a pseudo hypoparathyroidism. And if any patient present to you with pseudo hypoparathyroidism, guys, just remember these things in your mind, that the patient maybe have the problem of fourth and fifth digit. There is a small of a fourth and fifth digits. Okay, there's a problem with the round face or limb anomalies. Okay, if there is a mention that the patient the fourth and fifth digits are small, low level of the calcium and low level of the calcium, periodical numbness or the tingling sensation, then you have to say this one, the diagnosis is pseudo hypoparathyroidism. And other name of pseudo hypoparathyroidism is Albright syndrome. Okay, Albright, this one. Okay, guys, sometimes there is a problem that parathyroid hormone receptor like a peptide, mean that parathyroid hormone start to produce ectopically. What is mean by the ectopically? Ectopically mean that we know that parathyroid hormone basically produced from the parathyroid gland. Okay, this is parathyroid gland. Parathyroid hormone produced from the parathyroid gland. Now just take an example that if any patient has the lung carcinoma, okay, squamous cell carcinoma, just taking squamous cell carcinoma, and in squamous cell carcinoma, lung carcinoma, parathyroid hormone receptor like peptide are produced, and which work as same as parathyroid hormone. Now you know that parathyroid hormone is not producing from parathyroid gland, and parathyroid hormone is not producing from the parathyroid gland, and parathyroid hormone is producing from the lungs. Its production is known as a ectopic production, and the symptoms which can be occur in a patient due to the high level of the parathyroid hormone. These symptoms are known as a paraneoplastic syndrome. Okay, and this can lead to the high level of the parathyroid hormone, high level of the calcium, and low level of the phosphate. Okay, guys, now we are going to discuss all these things from USMLE step to CK, and after that I will just write the most important points which oftenly asked in the exam. Okay, guys, I hope so everything you have done. For the effect of the parathyroid hormone, serum calcium and phosphate regulation. Yes, for more thorough review of hypercalcemia, see the renal. I mean that they have discussed another chapter. Primary hyperparathyroidism. In primary hyperparathyroidism, what we see? High level of the parathyroid hormone, yes. High level of the calcium, yes. Low level of the phosphate, yes. High level urinary CA-MP. I have discussed all these things. Yes, and due to the high level of the calcium, what you will see? You will see pain in the abdomen, pain in the flank, polyuria, polydipsia, psychotic problem, all these things, and also diabetes insipidus. And just see, guys, primary hyperparathyroidism, most common cause is the adenoma. I also have discussed. After that, hyperplasia, and the least one is a carcinoma. There's not mention about the high level of the calcium. They just mention like this, but I have discussed everything in full detail. Okay, guys, now what is a secondary hyperparathyroidism? A percentage of high parathyroid hormone response to renal failure. Mean when there is a problem with the kidney. When there is a problem with the kidney, then we will not see the active form of the vitamin D, and the active form of the vitamin D is the 125 dihydroxy vitamin D, this one, which is also known as the calcitriol, which is also known as the vitamin D3. So what we will see? Low level of the vitamin D3. Due to the low level of the vitamin D3, what we will see in the secondary hyperparathyroidism, guys? High level of the parathyroid hormone, low level of the calcium, high level of phosphate. High level of the phosphate. We will see all these symptoms. Yes. Okay. Now we'll discuss the tertiary hyperparathyroidism. Tertiary hyperparathyroidism, and also there's a problem with the creat and urea level will also increase in this person. Okay. When there will be the tertiary hyperparathyroidism in a patient with the tertiary hyperparathyroidism, the patient is on the dialysis from the previous last 6 years, 7 years. Examiner will say like this: seen in dialysis patient with long-standing secondary hyperparathyroidism lead to the hyperplasia of the parathyroid gland, which one or more gland become autonomous, uncontrolled production. I also have discussed tertiary hyperparathyroidism. What it can lead to? It basically can lead to the high level of the calcium, high level of the phosphate, and high level of parathyroid hormone. Mean that everything will be high in tertiary hyperparathyroidism, and these things are very important, which are oftenly asked in the exam. Pseudo hypoparathyroidism, I also have discussed, guys, that in pseudo hypoparathyroidism, when the person will come to us with low level of the calcium, with periodical numbness, tingling sensation, chavostics and rosacea sign are the positive. Mean when we will see the patient, we will say that this patient has the low level of the calcium. The symptoms are due to the low level of the calcium. But when we will check the parathyroid hormone, we will say that the parathyroid hormone is high, and we were thinking that in low level of the calcium, the parathyroid hormone should also be low, but here in this person is not low. Why? The problem with the receptor. It means that here the problem with the receptor, and this condition is also known as a Albright hereditary osteodystrophy. Albright hereditary osteodystrophy. The problem with the mean that fourth and fifth metacarpal, and also the brown face, and also the problem like this one. What is written here, guys? Pseudo hypoparathyroidism, high level of parathyroid resistance receptor problem, high due to ineffective to target organ. Ineffective means the problem with the receptor. Okay, that's why there is written ineffective. Hypocalcemia and hyperphosphatemia we will see because the receptor is not working properly, associated with Albright hereditary osteodystrophy, and this condition is another shortened fourth and fifth metacarpal and carpal and metatarsal and metacarpal, guys. Okay, now most cases of the primary hyperparathyroidism are symptomatic but may show sign of the hypercalcemia. I have discussed everything about the hypercalcemia, that how you will treat the patient with hypercalcemia and what are the symptoms of hypercalcemia. I have discussed hypercalcemia is associated with the stone, bone pain, okay, stone, bone pain, moans, groans, mean that there is a pain, that's why this mentioned moans, groans, and psychiatric overtones, mean there is a psychotic problem with the patient, there is the anger issue like this. Administration IV fluid is the first line I have mentioned, then calcitonin and bisphosphonate if there is a malignancy, guys. Okay, other than that there's written what we will see the lab values. In lab values result, the primary hyperparathyroidism result with hypercalcemia, hypophosphatemia, and hypercalciuria. Intact parathyroid hormone is inappropriately high relative to total ionized calcium, and other than that we can see that there is a tumor, maybe there is a problem of the parathyroid gland tumor, so we perform a scan. What is the name of the scan? The scan is a SYSTEMAB scan, 99 tactinium scan or the SYSTEMAB scan in conjunction with thyroid ultrasonography can help localize a solitary adenoma, mean that this will tell us that maybe there's a problem, there is a adenoma, the tumor in the parathyroid hormone, that's why maybe we are facing all these type of the symptoms. And we know that to check the osteoporosis, to check the healthy bone or the health of the bone, we perform the DEXA scan. And in primary, secondary, or tertiary, in every type of the hyperparathyroidism, what we will see? We will see the resorption of the bone. It's mean that the breakdown of the bone will see in a person. When we will see the breakdown of bone, it's mean that we will see the osteoporosis. DEXA mean reveal low bone mineral density and frank osteoporosis. Distal radius of the side. Distal radius, there is mentioned that because most common site is the distal radius. Consider renal imaging. Why we are performing the renal imaging? Because we should know that high level of the calcium in the hyperparathyroidism, high level of the calcium, we know in primary hyperparathyroidism, high level of the calcium will start to accumulate and damage the kidney, and this condition is known as nephrocalcinosis and nephrolithiasis, mean the kidney stone. That's why we can perform the ultrasonography of the kidney, and we also have to do our diagnose, and also we should do the renal function test. These are the important, but here not mentioned. You have to write why we are going to perform the renal function test. We know that if there is a problem with the kidney, urea creat level will be the high, and that's which will show us that we due to the high level of the urea and the creat, the patient have the high level of the parathyroid hormone. This condition is the secondary hyperparathyroidism. What is the best treatment? IV fluids. Also we will give for acute hypercalcemia IV fluids, calcitonin and bisphosphonate long term. Other than that, parathyroidectomy. Okay, guys, for example, if a patient have the high parathyroid adenoma and this tumor is very mean that you have to say that is working so worstly, and it's increasing the high level of the calcium, and so due to the high level of the calcium we are facing the symptoms of the bone pain and also body pain, and other than that loan and groans, pains, moans, other kidney stones, all these type of the symptoms we are facing. Okay, and these in what we will do in these type of the cases, we will perform the parathyroidectomy. And when we will perform the parathyroidectomy, seen guys, parathyroidectomy if the patient is symptomatic or if the certain criteria are what are the high calcium, high creat, bone mineral densities are low, mean when there is a high level of the calcium, and these calcium are also targeting to your kidney. When these are the calcium targeting to your kidney, it's mean the kidney are going to damage, and this can lead to the nephrocalcinosis. Okay, that's why creatinine level is high. Low bone mineral density, and in this case solitary adenoma, one gland can be removed. In the parathyroid hyperplasia, what you have to do? With 3.5 gram gland, with 3.5 gland must be removed in a patient with the parathyroid hyperplasia. Okay, guys, and these are the lab values. In primary, parathyroid hormone high, calcium high, low phosphate. In secondary, parathyroid hormone high, calcium may be the low, okay, high phosphate. Okay, in tertiary everything is a high. Okay, guys, in ectopic production, the main parathyroid hormone level will be the low, calcium will be the high, and phosphate level will be the low. In a patient with a chronic kidney disease, administer oral phosphate. Guys, we know that the patient who present to us with kidney failure. Okay, in patient of the kidney failure, what we see the high level of the phosphate in the blood. These high level of the phosphate which are present into your blood, basically it also bind with the calcium. When high level of the phosphate start to bind with the calcium, so the free calcium level will decrease or no? So the free calcium level will be decreased. When the free calcium level will decrease, it cause the tetany. It cause the tetany symptoms. I mean periorbital numbness, tingling, like these type of the sensation. We'll see low level of the calcium. So what we have to do, how we can treat the patient with the hyperphosphatemia? We basically give the drug. The name of the drug is a Swilmer, which bind with the phosphate. When it will bind with the phosphate, it will inhibit the absorption of the phosphate from your GIT, and where it will go into your stool. When it will go into your stool, then what is going to happen? It will basically decrease in your body. Okay guys, so these are the drugs here's mentioned. In patient with chronic kidney disease, administer oral phosphate binder. Yes, binder. Calcium salt or Swilmer, hydrochlorothiazide and lanthanum carbonate are these are the lanthanum carbonate, Swilmer, and restrict dietary phosphate intake to prevent the hyperparathyroidism. We mean that we have to prevent the phosphate intake. Okay, these are the drugs which bind and also decrease mean that these decrease the absorption of the phosphate from your GIT, and when it will bind, where it will go into your stool, and when it will go into your stool, it will basically remove from your body. Okay, one is a cinacalcet. Guys, just take an example. Cinacalcet is given in a patient who have the high level of the parathyroid hormone. What are the complications of the parathyroid hormone? High level of the parathyroid hormone basically increase the level of the calcium, and it can lead to the hypercalcemia. And hypercalcemia symptom I already have discussed. But if we perform the surgery, mean that we do the parathyroidectomy, if we do the parathyroidectomy, what is the main complication of this one? Hypocalcemia. When we will do the parathyroidectomy, parathyroid hormone level will be low. When parathyroid hormone level will be low, it means that the level of the calcium will also low. So here's a mention that we know that basically parathyroid hormone brings the calcium and phosphate from your bones into your blood. Now what you will see when you will do the parathyroidectomy, low level of the parathyroid hormone. When there will be the low level of the parathyroid hormone, now the calcium and phosphate both will not come into your blood. The both calcium and phosphate will remain into your bones, and it can lead to the high mineralization. And here we are going to discuss severe and prolonged hypocalcemia caused by acute reversal of parathyroid hormone, high in bone uptake of the calcium and phosphate. Means there is a high intake of the calcium and phosphate in the bones, because parathyroid hormone is not working, who brings the calcium and phosphate from the bones to the blood. And there is a hyperparathyroidectomy can be caused by ectopic hyperparathyroidism can be caused by ectopic parathyroid hormone production, particularly from the carcinoma of the breast, lung, and head and neck. This is known as ectopic. I already mentioned that no, the parathyroid hormone is not producing from the parathyroid gland. In this condition, parathyroid hormone is basically producing from other side, from the lungs problem, from the breast problem, from the head and neck problem. Okay, guys, all these things are the important. I hope so you have understand each and everything. And if anyone have a low level of the parathyroid hormone, this condition is known as a hypoparathyroidism. The most common cause is a parathyroidectomy. Maybe you remove the parathyroid gland with the surgery. Number one. Number two is a DiGeorge syndrome. In DiGeorge syndrome, what you will see? In DiGeorge syndrome, third and fourth pharyngeal pouch basically produce the parathyroid gland and also thymus. But when third and fourth pharyngeal pouch will not produce, parathyroid gland will not produce, thymus will not produce. So in this patient, what you will see? Low level of the parathyroid hormone and high level of infection. Why infection? Because thymus play an important role in your immunity. Okay guys, there's some infiltrative problem which basically damage your parathyroid hormone, and these are the hemochromatosis and Wilson disease. In hemochromatosis, iron basically damage the parathyroid gland. In Wilson, copper basically damage. Okay, this one post hypoparathyroidism is included. Iatrogenic mean post surgical. Okay, number one. Autoimmune, congenital, DiGeorge syndrome, and infiltrative hemochromatosis and Wilson disease. So these are the hypoparathyroidism, and we will discuss each and everything in full detail. Okay guys, if you have any type of the question, you can mail me on my email ID dr.zabi776@gmail.com. Okay guys, I will able to give you answer of your every question on my email ID.